How many of you have done the upper extremity block, especially of all of you? Supraclavicular and interscalene. I think
Axillary.
axillary.
Block, but not axillary nerve. No.
Axillary is that way. That is the supporting for humerus for the shoulder joint. So what we hear today is learning about the interscalene and supracurville approach. Basically, the brachial practice, you can trace them from where they appear in the C5, C6, C7, and then this is above the clavicular. So you have the interscalene and you have the supraclavicular approach. So it's basically the same thing, but either you target it when they are still in the root and division, root and trunk, and then lower is the division. In the infraclavicular, they are already in the different area. Okay. So I just pre-scanned this patient. So as for ergonomically, I'm not recommending you are standing on this side and doing the block. I recommend that you are from that side. The ultrasound is his side, and then as for the position, I suggest you put something in the shoulder to make it easier for you to point the needle, because if the patient is lying down perfectly still with this pillow, you cannot see very clear. Okay, and then you scan it first. Okay. C6, they say it's in the level of cricoid, but you can actually see it when you, for your landmark, you can start with the CA and the IGV, and then you push it laterally. You can see this is the sternocleidomastoides muscle. Laterally, you are supposed to see the scalenus anterior and scalenus medial, but I've pre-scanned this patient and it is not that clear in this side. And you can see more lateral. You see the shape of the C6 or C7. Which one is it? This one has still one head. This one. Okay, you can see they have two heads here, and then you move further up. Two heads. This is the C5. Okay, you can see there's one coming out from this, and another. This is a C6, and if it's pointing just one, then it's C7. Okay, so, yeah, C7 that one. Okay, and then you move it down. There you can see this. This is the anterior scalenus. This is the medial scalenus, and this is the interscalene. Theoretically, this is the C5, this is the C6, and C7 should be around here. As Dr. Sakura said yesterday in his talks, that this is not C6 or C7, this is both C6. And if you want to point your needle, you don't have to divide this to roots. You just put it here under the fascia and then just hydrodissect. Okay, it is actually now easier, as you have seen this. You call this the butterfly sign. Yeah, the both of this muscle, the scalenus anterior and scalenus media, shape as the wings, and the body is consistent of the plexus. Okay, and then you slide it down more. Here, as you can see, all the plexus, it has already joined, and it has already formed a division. Okay. Yeah, and if you're listening to Professor Manoj talk about the earlier branch to the suprascapular nerve, yeah, you can see there are arterial structure here. Yeah, this is the circumflex. You have to be careful if you want to do this. This is actually the anterior is starting to give branch. And then, okay. And you will go down and go lateral. It's because the nerves, the plexus are traveling this and going lateral. Okay. Here, you can see this is the subclavian already going down. Okay. And this is the anterior. The upper, the middle is not shown, and this is the middle and the posterior. It already formed into division. Okay. Okay. And then if you want to go further and the other station, then you have to go below the clavicle. Okay. I think to save time, all of you can try. Because you don't have much time and you have 5 of you, you have to go hands-on. How do you, okay. Let's look for, okay, you're going too far up. If you can't find it, go downward. Yes. Yes. Just a little bit to the lateral. Yeah. Do you find the tubercle? You see the tubercle here? Yeah. Yeah. 6, yeah. There you go, 7.
6 is 2 heads, is it?
Yeah, 6 has 2 heads. And 2 prominent heads. 5 also has 2 heads, but not so prominent. Okay. Now they are starting to look like the butterfly. Okay. Another thing that you should know if you're doing the ultrasound is put your hands on, rest on your patient, because put your palm, your proximal part of your. Okay, you can hear. The thing is about supraclavicular interscalene is the one of the block that you can train by yourself, because you can scan yourself and you can scan everyone, and without having to fear exposing yourself to anybody. Sorry if you're wearing the hijab. Okay, this is it. This is a C7. You have to be careful sometimes. You're placing your probe here, but you're tilting your probe down. So you just this is a C7, and I'm going to place it in the middle, and this is okay. C7, and then those are the plexus. Yes, this is where you can you show me the anterior scalene and the medial scalene? Anterior, okay. And the most superficial is the C5, and C6 is divided into 2. Okay. You can go from there. Yeah, like this. That's why you have to put something in the shoulder, because if you're not putting something in the shoulder, it's very difficult for the needle to come. Yes. Sorry. Yeah. Okay. Go down, and see the trunk is forming the. Yeah.
And then the suprascapular.
Suprascapular, you may not.
You say something that.
Yeah, something goes there.
This is
Yeah. This is the transverse. Okay, you just see it. Butterfly. Now they are forming a vision, and there's rising a branch there. That's the transversal vertebral artery. The upper one. You can see the vascular structure. CF. The one you see pulsating in the below section, that's the vertebral artery. That's the vertebral artery. That's one. This one. You can see that on the bottom part of the screen in the middle, you can see something pulsating. That's the vertebral artery.
That's the vertebral artery.
Yes.
Oh, okay.
Yeah. Okay. And here you can see it is transversal artery. And then you move it down. Sometimes when you hit the clavicle, you don't know where to go, then you can tilt the probe. But be careful if you were tilting the probe, and later you may find difficulty in pointing the needle. Sometimes you need to go, yes. Yeah, this is the bundle. Okay. It may be difficult for you if you translate it from your anatomy, especially the diagram and this and this. If you're using it for the first time, I suggest you use the nerve stimulator and see which part that correlates with the contraction that you wanted. Sometimes you don't have to hit them all, but sometimes the posterior, the vision is located so down that you cannot see. Yeah. Don't worry. It took years to finally memorize that and translate it here. Okay. C6, C6, C5.
Can you track scanning from down?
Check. Now you see the black structure over there. It is a muscle. But sometimes if you tilt it too much, you will get the image of the subclavian artery. See, this is the subclavian artery. Yeah, so this is the one that you have to be careful about, because when you tilt it too much, then the image you're getting is the subclavian artery. Okay, okay, okay. This one. Okay. Okay, so it is located next to the subclavian artery. Okay, so you can see pulsating. Oh yeah, you have 3 stations. Okay, please.
It's basically the same.
Okay. Okay. Alright. Just try to scan it perpendicularly. Start it, and then if you cannot see anything, then you can go by tilting. First, you can scan the vascular structure if you're confused where you are, and then move laterally. Okay, until you get the image of the vertebrae. Yeah. You move down, You move up and down. You got the first. Yeah. Okay. And then
then go down.
then you can go now. This is the anterior tubercle and of the C6, and then you move it laterally, and then you start scan here. You see, one of it's coming out. Yes, yeah. You can see it. Can you see it? It's in the top screen. And then you move laterally more. I cannot see it. Cannot see it. This is too low. Sorry.
If you come in here, then you probably orgasm. Here is
This is the C5. You can see the C6. Sometimes you have to rotate it because they are moving. This is already formed. This is actually the one, but the image is not that clear. It's okay. You can hold the probe again. Sometimes may need a little jelly. It's okay. Okay. You can place your palm on. You can rest it because if you're not resting it, then you're not stable enough. Okay. Go. Sinakledo. Actually, this is the one, but it is not that clear. You can see one of the. Okay, scan it down. Scan it down. This is the C7 going up. Okay, going down. Yeah, this is it. But not that beautiful. Okay. Tak nampak bagus.
I also don't see the
It's already joined down below, so it is not that. Okay. This is it. The medial scalene is not that good. I mean, no, it's not. I mean, one of the view in this in his muscle, you don't get another a pair of flying wings. Okay, can you see it? The C5 is the most superficial. C6 is divided into two, and C7 is sometimes you're hitting it at the C7, so it may not coming out yet. So you have to. So this is one of the caveats of doing interscalene. The C7 and C8 it has not already coming out, so it doesn't cover the lower parts of your hands, the distal part of your arm. Okay, then scan it all the way down. As you can see, it already joined and formed a trunk. And superior and middle, and the other one is inferior. Inferior you cannot see, is in down, and the superior give branches for the suprascapular is from the the supracurville is from the superior. Okay. Okay, just scan it. Again, after you hit the clavicle over here, after you hit the clavicle over here, this is what you see here. This is the subclavian artery on your right side of the screen, and then those are the plexus, but already becoming the trunk. This is the anterior, middle, and I don't see the posterior. And then this is the artery, the circumflex. There, yeah. Sometimes you don't want to hit it there. Okay. And if you I'm stuck. I cannot go down more. Then you can tilt it. Okay, and move it laterally. Okay. Okay. Those are the. If you're doing the, I just want to do blocks. I just want to hit them. I forgot all the landmarks. Okay, I forgot all the landmarks. Just scan it and see the anterior and medial. And you scan it down and you see, I can see it form into flexus. Sometimes you cannot see the red light sign moving, seeing very clear. You just move it. And then remember that the plexus is coming from here and it moves all the way laterally. So when you're scanning, you just don't have to scan it downward, but you also scan it laterally. So it kind of goes diagonally. Okay? Any of you? Come on. Come. Okay. You're going straight for the supraclavicular.
Yeah, usually you start from the supracurville and go up to through the.
Oh, you usually go from supraclavicular going up. I usually go from up to down. That way I can know which one is this, which one is this. This is 65.
Usually you go from where?
Up.
To down.
Up to down.
From where? The
From
cricoid.
cricoid. Yes. Okay. You're hitting it at the right level. Okay, that's the. Sometimes you just have to move it, rotate it a bit. So you cannot see here. Where is it? There. Tak tampak lagi. This is too way down. Sometimes you have to rotate it a bit. There you go. That's a C5. Oh, I'm moving too much. So, C5. There you go. As you can see, I already. Okay. As you can see, I'm not pointing it exactly like this, but I'm scanning it exactly in the plane of this because the scalene muscle moves from here to here. So you go perpendicular to the muscle.